Hi, my name is Fred Ho, and I am the Ontario Patient Education and Support Manager at the Leukemia and Lymphoma Society of Canada. This video is on the psychosocial effects that many cancer patients encounter and struggle with during and after treatment. The presenter is Dr. Margaret Fitch, who is a professor at the Bloomberg Faculty of Nursing at the University of Toronto. And she is also a research associate at the Sunnybrook Research Institute. Her research is focused on supportive cancer care with an emphasis on understanding the patient perspective. Dr. Fitch will be discussing psychosocial issues that many cancer patients experience. Feel free to contact us for further information, support, or to get involved with the Leukemia and Lymphoma Society of Canada. Thanks, and enjoy the video workshop.
Again, I am delighted to be here this afternoon, and I look forward to having our time together. And I'm going to focus on the psychosocial issues as they relate to cancer, the experience of cancer. And I'm hoping that I'm going to keep my eye on the time and not take up all the time with my talking, but actually give you an opportunity to contribute as well. So the plan for the session would be for me to say just a word or two about myself so that you know my background and why I'm saying what I'm saying this afternoon. And then I'm going to talk a little bit about the psychosocial effects, just to help us all be on the same page and understand this particular area. And then talk together with you about what we've learned over the years from patients, from family members, about coping and adapting during this cancer journey. And hopefully at the end, as I say, we'll have an opportunity to talk together. So let me start by saying that I often use this particular slide as a way of reinforcing the idea that I have heard from patients that entering an experience with cancer, a cancer journey, is like going to a strange land where the course isn't entirely clear, the language isn't entirely clear, it feels like you're talking in a different language. It's a little bit like a labyrinth and a puzzle-solving exercise to try to figure out what to do, where to go, who to turn to, and where to look for support. Now, as I talk this afternoon, I'm going to be sharing with you what I have learned over the years as a researcher in the area of coping and adaptation. My background is in nursing, and over the years, I have engaged in a good deal of work with individuals who have had different types of cancer and focusing on their experiences, the kinds of challenges they face, the kinds of solutions that have actually worked for them. So through all of that research, I have pulled what I'm going to be saying this afternoon, and hopefully you will hear the voice of some of your peers as you listen to me in the time that we have together. So from that notion that one is entering a new space or a new land as one is facing a diagnosis of cancer and being treated, then the notion of so much is unknown, so much is uncertain will pervade some of the conversations that we experience this afternoon. Many times what people will talk about is that once that diagnosis is heard definitively, the journey really is one of transition. Life is never exactly the same again. And at every step along the way, there is something that is different. There is something that is new, something that has not been experienced before. And as people talk about that journey, there are particular points or particular milestones that stand out for them as points where the change or the transition has really come home to hit them or to become part of their reality. As they move along that journey, they are individuals who have fundamentally not changed. They are still who they always were. And they are beings, human beings, and as human beings, we are more than just physical bodies. We are emotional beings, we are spiritual beings, we are psychological beings, and all of those elements of who we are and our personality, we carry with us through this cancer journey. So one of the other things that I want to leave with you is that notion that as we move through that journey, we don't fundamentally change who we are. We bring with us all of our coping abilities, all of our strengths, and all of our weaknesses, and that becomes part of what characterizes the journey as we move along. So I know I don't have to tell anybody in this room that cancer, its diagnosis, its treatment, has more than a physical impact. We heard lots of wonderful information about the cells and the genes and the tumor. But in fact, the journey or the experience is about many more elements. There are many consequences that come along with the changes and the transitions that unfold for individuals. And those changes that people feel come at different points in different ways for each one of us. We can be sitting beside someone else and their reality, their experience is going to feel different to them than it does to us. But yet at the same time, as we listen to the stories, as we listen to the narratives that people share with us, there are common milestones or common elements for us to be thinking about. So I'm just going to take us gently and quickly through that particular journey. And what I'm trying to do here is bring out the things I've heard from patients and family members about the key issues that are challenges for them at those different points, at those different milestones along the way. So the first, of course, is the whole notion of thinking something is wrong, feeling that something is wrong, maybe not being able to put your finger on it or not being able to describe exactly what's different. And for people, knowing the signs and symptoms and knowing what to go to your doctor about is a major challenge for individuals. And actually having the conversation with the physician, being heard when you have that conversation, especially if some of the conversation is a little vague or you're not quite able to pinpoint what you're saying. Sometimes there's a feeling that you're not heard. And this is one of the things that I've heard from patients, that struggle to be able to tell somebody else, a physician, a nurse, what's going on with you. Now, if it's a situation where there's a dramatic change, a dramatic shift, and something happens and you end up in an emergency department, that's a different story altogether. But otherwise, sometimes it can be difficult to actually know whether help is necessary. Undergoing tests is one of the other milestones that people will describe to me as one of the most challenging times because you are constantly preparing, undergoing the tests, then waiting for the answers and not quite sure what the answers are going to be, but beginning to play all of those through in your mind about the possibilities. Knowing what the results are actually going to mean and getting hold of information is one of the major things that people feel challenged, frustrated by, and angered by. And at this point, many individuals will say, I felt totally out of control, like something else had taken over my life and I was on an assembly line. These are some of the phrases that they've actually shared with me, some of the concerns that they've had as they've moved along. Actually hearing the definitive diagnosis was a moment of utter disbelief, of numbness, of thinking that maybe they got it wrong, maybe these are not my results. And then the reality of what does this mean? What's ahead for me? And how do I actually tell other people? Especially if I don't know a lot about what this means, how do I then talk with other folks and tell them what's going to happen? So what I'm trying to do with this journey is let you know what other individuals have talked about what some of the common psychosocial issues are that people experience as they go through this journey. Once having had a definitive diagnosis, then the issue is making a decision about treatment. What treatment, what that treatment course is going to look like, what implications it will have. Can you continue to work? Do you have to stop work? How long will that be? What will happen to the family? Will it mean hospitalization? All of those ramifications of actually being on treatment. And of course, as you well know, different treatment for different types of cancer. And so chemotherapy or radiation or surgery or combinations of those have different impacts or implications. And for many folks, figuring out what those implications are, getting access to information so they can plan their family lives and plan their reality is a major challenge. Often what people will talk to me about is the idea that treatment has a starting point, it has the reality of unfolding and happening, and then there's a point where it's finished. Different cancers, that finish point varies, and for some individuals now, the treatment doesn't actually finish. As you know, it carries on and carries on. I think one of the major pieces for folks is the uncertainty at the beginning of treatment, not knowing what it's going to be like, not knowing what they're going to feel, not knowing what the impact is going to be, and then waiting through the course of treatment to see what's actually going to happen. Is that treatment going to be effective? And learning how to live with that uncertainty is another major challenge. For many individuals, the course of treatment is arduous. There are multiple side effects, and often those side effects are happening together. So it's not just one, it's multiple side effects. And you're going to hear a little bit more about two in particular, fatigue and the impact on cognition or brain function. What you may well hear about is the interplay between not sleeping, being tired, not being able to think, not being able to sleep. And it's a cycle that continues, and that reality can be a challenge. For individuals who come to a point of saying the primary treatment is finished, we are moving on control of the cancer or long-term care, or we've actually finished the primary treatment and it's time to think about rehabilitation. This is actually a new era for cancer in terms of rehabilitation or survivorship. For many, many years, we didn't have the number of individuals who don't have clinical evidence of disease or who are living with controlled disease. That is new. We've never been at this point before. And the reality now is many individuals will say, I felt like I finished going to the cancer center regularly, and now what? Where do I turn for my support? Where do I turn for help at this point in time? What do I need to be doing in terms of physical exercise? What do I need to be doing in terms of nutrition? Many questions, and again, that search for information about what can apply to me at this point in time. The fear of recurrence is one of the major psychosocial issues that people will talk about. And I've had many individuals say to me, I never let go of that fear. It's with me all the time. Now, it gets a little less intense over the years, but it's always there. It's always in the back of my mind. Once you have faced that cancer diagnosis once, then the reality is recurrence could be part of your reality. Now, as I was saying, this notion of survivorship is a new development in terms of the cancer world. We haven't really had the number of individuals who are living after a diagnosis and treatment that we have right now. More than 1,100,000 in Canada right now, and that number is growing day by day. The reality is there are many unanswered questions about how you live through survivorship and what are the kinds of issues that you are going to be facing. How do you deal with them? There are more and more research projects trying to uncover, trying to describe and find interventions for that. But it's new territory, and I think that it's important to actually acknowledge and recognize that. At this point in time, we're seeing remarkable progress in pediatric patients. We saw in our video just a few moments ago that one particular young girl's story, but we're also seeing progress in terms of adult cancers as well. Out of that progress, we're actually recognizing that individuals who've been through the journey have a wisdom from their experience and have an ability to say, you need to do this differently. You healthcare professionals need to improve on what you're doing with care in this kind of way. So I'm beginning to see right across the country more engagement on the part of survivors and family members in program development, in intervention development, in research, in trying to improve the actual cancer journey and the cancer time. We are beginning to recognize that there are late and long-term effects from having been treated with cancer. The fact that we have the cadre of individuals who are living that experience gives us the opportunity to try to describe and articulate some of those changes. So I'm going to just take a few moments and share with you some of the quotes that I have heard from patients. And I should probably say that the pictures I use here are stock photography that I've purchased for the purpose of doing the presentation. So they're not people, that's not quite the right way to say it, is it? They are people, but they are not patients or survivors. The notion of emotional distress, I would say one of the most remarkable developments right now in the cancer world is the recognition that every experience with cancer comes with emotional distress. For many, many years, that was not acknowledged outwardly. And in that regard, everything was focused on treating the tumor, not caring for the person and not supporting the person. But we're beginning to recognize now that that emotional distress is part of the reality, needs to be acknowledged, needs to be supported. And what you're beginning to see now are support programs, either face-to-face, in groups, across the web, on hotlines. Those kinds of programs are now becoming more plentiful, and some of them are actually being focused then on certain cancers so that individuals can actually talk with other individuals who've had the same type of cancer that they do. The idea of one's sense of who they are has been shattered. And this is one of the quotes that I think is very insightful in terms of actually spelling that out. The idea of feeling like a broken teacup being shattered and not sure that that teacup is going to get put back together again or be strong. So that question of, who am I now that I've been diagnosed with cancer? Am I the same as I was before? How am I different? Questioning that and trying to search through and find the answers is an issue. People will be living with pain, with chronic pain that waxes and wanes. And one of the things that I keep hearing is the notion that the physical symptoms have an impact on how one lives one's life. And sometimes it's the impact of those physical symptoms that create the frustration, that create the anger, not being able to do some of the things that you could normally do, not being able to garden, not being able to go to work in quite the same kind of way. We're going to hear a whole lot more about fatigue in just a moment, so I won't dwell on that at this point in time. But I will emphasize it is one of the side effects that the majority of cancer patients and survivors will talk about. If we were talking 10 years ago, we wouldn't be talking about fatigue, we'd be talking about nausea and vomiting, or maybe 15 years ago. But there has been progress in terms of managing nausea and vomiting, and with the new therapies that are actually coming on board, fatigue is now the one that is surfacing. But as I say, we'll hear more about how to cope with that and deal with it in a few moments. I brought this particular quote along. The notion of lymphedema and swelling of a particular limb or a particular body part. Sometimes it's not so much the actual limb as what it doesn't allow you to do. That's what people will struggle with. So in this instance, not being able to do housework, not being able to drive. One of the other issues is then sexual changes and relationship changes. So individuals who, depending on their age, may in fact be faced with fertility issues, sexual changes in terms of relationships, and the sense of what your body looks like, how your body feels. And I would say that it is only as we've begun to learn more about the survivorship phase that these kinds of issues are coming to the forefront, and they're actually being talked about and being made visible. For many years, nobody talked about sexuality. Nobody talked about the kind of bodily changes that one experiences. The sense of loss or feelings of loss or grief that people experience when some of the dreams of their life are now shattered and are now shifted or changed. And what I hope I'm doing here at this point is in some measure validating for you that these are the kinds of issues that are real, that people are actually experiencing, but in some ways don't get a chance to talk about. Sometimes in the course of a short clinic visit with a physician or with a nurse, these don't get raised. And the question is always, where do I go? Where do I turn? How do I deal with my questions? And how do I manage? One of the other areas that often has not gotten talked about until recently, as we have had more survivors, is the whole area of spirituality. And that sense of wondering why this happened to me. Why did this come my way? Some of the issues around what does it mean for me now? If I have been cured, what does that imply that I need to be doing with my life? And changes in roles and relationships. There are bodily changes, self-image changes, feelings about one's body, feelings about who one is, and that has impact then on how you relate to other people. And whether that relationship existed at the time of the diagnosis or whether you're in the process of creating a new relationship. Those then become challenges for people to sort out how they might deal with it. And one of the other areas that I am also hearing more and more about is the notion of returning to work. There are more individuals who actually want to either continue work during the time they are undergoing treatment or they want to return after they've finished. And again, it's an area that for many years no one actually raised, talked about, and thought about how I'm going to manage this or what I'm going to do with it. At this point in time, there are a growing number of programs that are beginning to become available, but very few right at the moment across Canada. And as I've indicated, the whole notion of fear of recurrence something that people live with, struggle with, and becomes part of what's at the back of their mind. So I think the final issue that I'd want to put before you is the notion that much of this experience, this journey of transition and change, is also a journey of uncertainty. Not having answers, not having certainty. Often the diagnosis of cancer is a moment where people will say, I thought everything was in control. I thought I was managing my life. But now suddenly, everything's topsy-turvy and changed. Things are different. Things are never going to be exactly the same. And even once treatment has happened and one is living with or living with control disease, there are so many unanswered questions. So one of the major psychosocial challenges is, how do you live with that uncertainty day by day and not let it take over your life and the decisions that you are actually making? So I would say one of the main developments that we've actually seen in cancer care is the recognition that distress is part of the cancer journey. And there are acknowledgments that that distress is going to happen in different ways for different people. The idea that's emerging in most of the conversations I have is that the distress that you feel, that emotional turmoil, runs the gamut from one end of I've tried to represent here at the left-hand side of the slide, the normal reactions one has to stress and being upset, to the other end where there's an intense reaction that could almost interfere with the problem solving and the day-by-day decision making. And what we're recognizing is that there are points along the cancer journey where this distress goes up and becomes more of an issue, and then it might dissipate a little bit, and then it goes up again. That these milestones are points in time where people will say, that distress was higher for me then. It's gotten a little easier, and then it went up again. Part of what we're learning at this point is that we need to be sharing this kind of information so people recognize there is a part of that cancer journey or part of that cancer experience that is about feelings, that is about relationships, that is fraught with uncertainty. And that shouldn't be ignored, it shouldn't be pushed to the side, but we should be acknowledging that there are ways that we can deal with it. So the key points that I would like you to leave with, remembering we're all unique, we're all individual. And even though I've tried to talk about common psychosocial issues, everyone is going to experience those a little bit differently. And what's going to bother one person will not necessarily bother the next person in quite the same way. And we need to be really careful that we don't expect everybody's going to react the same way and everybody's going to cope the same way. The emotions and behaviors that we actually see in one another and experience in ourselves are very much a product of the person you are, your own being. And I think part of the reality is being able to say, we are going to do this in our own way. Now, what patients have actually said, and survivors and family members have said to me, there are some things that make a difference in terms of my ability to cope, my capacity to cope. And yet, at the same time, everybody wants different amounts of these things. One is information, making sure that you get the facts of the situation so that you know what we understand to be the course of events. You know that you're not substantially different, but rather you're experiencing something that is part of that cancer journey. There are websites that are credible, organizations such as the one that we have here today. Those are invaluable in terms of getting information and sharing information. The only thing I will say is that sometimes the psychosocial pieces don't get shared quite as easily as some of the others. Support is one of the other elements that people will say, this makes a difference. Some people will want support from other patients, from other family members. Other individuals want support from professionals. And I would say one of the first things to think about is what's going on at the cancer center where you've been diagnosed and treated. Quite often they do have psychosocial experts. But on the other hand, there are then peer support organizations. The Canadian Cancer Society has a hotline that anyone can call at any point in time. We have organizations like Wellspring and Gilda, where here in Toronto and other parts, where you can actually have face-to-face meetings. Different people will want different things. Some people like to talk, some people don't like to talk. They will very quietly do their own reading, do their own thinking, do their own reflection, and not necessarily want to talk out loud with a group. The idea of communication is really focusing on the idea of developing ways to interact with your care providers so that you get the information that you need. Going in with a list of questions, making sure that you've thought about your questions ahead of time and you can ask them during the course of the clinical appointment. The access to services, and I used the word here, relevant, because different people will want different services. Some people may want to see a sexual counselor. Some people may want to go to a personal trainer for exercise rehabilitation. And in some ways, the last point that I have here, this notion of self-care, part of what I'd like to leave you with is the notion that you are in the best position to know what's good for you. You know what you like, you know what works for you, you know how you cope. And that's the first step in terms of coping with some of these psychosocial effects. Be who you are, connect with the people that you know, and in effect, be true to yourself and recognize that you do have skills, you do have the capacity to cope with this, and you're not alone. There are other people you can turn to and ask for help.